Good afternoon, everyone, and welcome. We'll give it a few more seconds as everyone joins us today. All right, we'll give it a few more seconds before we get started. All right, let's get started. Well, hello, everyone, and welcome to the Industry Showcase on June 21st. My name is Ashley Caesar. I am the Programs and Events Specialist here at Digital Health Canada. All right, so today's Industry Showcase is called Reimagining the Patient Experience with Intelligent Automation. And it's a pleasure to present to you. We have Dr. Chow. He is a global healthcare industry lead at Automation Anywhere. And we also have Chow. He is a Vice President and Canada's Country Manager at Automation Anywhere. All right, so we will have time for Q&A at the end of today's presentation. Feel free to type your questions at any time in the chat box, and we will get to it during the session. All right, thank you all again for being here today. A warm welcome to all our attendees and our presenters today. And I'll now pass the screen over to you, Chow.
Thank you very much, Ashley, and thank you for having us. Good morning, good afternoon, everybody. It's a pleasure to be with you. Thank you for joining this webinar. We have great content for you, and the good news, it's not coming in the form of slides. This will be the last and only slide you will see in this session. I'm excited and happy to introduce you to Dr. Chow, who is a global healthcare leader with one of the most impressive CVs I've ever seen, a medical doctor with tons of experience in innovation in the medical environment, and also Tyler Stout. Tyler is joining us from the US as well. He's a senior director in our healthcare practice, and he's an SME. Goes very deep in all the major healthcare providers across the Americas. We have Dia. Dia is a Toronto-based, works in our team in Canada. He's a client director responsible for healthcare. The reason I asked Dia to join today is one, because he's very close in the trenches to the Canadian healthcare environment and knows the challenges, and I will ask him soon to share a bit of those. And then also I'll ask him to share a bit of his own experience as a son, as a father, and how he is as a client of the healthcare system, and what are the challenges he sees and how we can help that. So now if okay with everybody, I'll stop sharing, as I promised. Last slide. And I want to speak a bit about, maybe a minute about Automation Anywhere. So we've been around. We're almost a 20-year-old company, doing extremely well with over 5,000 customers worldwide. And what we do is so relevant to our times. We are in unprecedented times. 2.5 years, we want to call ourselves post-pandemic. We all hope that is the case. But that created a lot of challenges and opportunity. The challenges are very big in the healthcare environment. We know that a lot of medical procedures were postponed, so new bottlenecks were created. We know that patient care was reduced. People were actually scared to go to the hospital or go to the clinic, and the industry has to reinvent itself. One, to unclog all those bottlenecks, but two, to continue growing and provide even better patient care, that patients will be confident to go in and know they're getting the best care, getting the best outcomes. So we'll touch a lot about that, and because automation is the way to take all those mundane tasks, all the things that healthcare professionals do that actually contribute less to the outcome, to the patient care. So we'll speak about that, and we'll try to have it a very vibrant discussion, dynamic discussion. And I invite you all to participate. Put it in the chat. We're monitoring it. We won't wait till the end. We'll try to make it as interactive as possible and answer your question on the spot. From here, I'd like to start with Dia, actually. Dia, like I mentioned, is in the Canadian healthcare trenches, and I want to hear from him. What are you hearing in the last couple of years? How are things changing? And what is your own personal experience with healthcare in Canada?
Perfect. Thanks a lot, Tal. Hello, everyone. Good morning, good afternoon. So, I mean, here's what I'm hearing in the field today as I talk to everyone. If you wanted to summarize it quickly, I think everyone would agree. You'd be very hard pressed to find somebody in the medical field today that isn't drowning, right? Everybody's busy. There's a huge backlog, as Tal mentioned. And unfortunately, of course, there's, that's going to trickle down to patient care, right? If you wanted to talk personally how that affected me both as a father and a patient, I mean, I used to be able to, I would tell you right now, for the last year, if I tried to get an appointment for either myself or my children, I would get the appointment would be a week, 2 weeks out, which would end up making me go to the walk-in, right? Walk-ins are fine. I mean, that's good, fine option. But the problem with that is they have no history, right? It's still just a one-of. It's all, I don't want to call it fast food medical care, but you're just in and out in 5 minutes, right? It'd be much better, obviously, to go see our own either family or pediatrician. But for the last year and a half, that hasn't been an option, right? So kind of what I wanted to do today is discuss, at least for here in Canada, what's created this massive backlog. And then after that, I want to kind of get into how the doctors today are spending their day, just to kind of see how, where the opportunities are where we can help, right? So, let's begin with why is there such a backlog, right? I mean, I was talking to one doctor just last week, and he said it to me, it was very simple, right? He's like, listen, Dia, he's like, imagine you're an accountant, and for 2000, because of COVID, 2019, 20, 21, nobody filed their taxes, right? Everybody just kind of hung back, whether it's because they're worried to do it or whether because, the government told them they didn't need to or whatnot. The taxes weren't filed. And now, let's hope this is the end of the pandemic. And now, you get these clients all coming saying, okay, it's 2022 now. I need you to file my 19, 20, 21 taxes, right? As you can, right off the bat, you can tell that is an immense ask, right? Doctors are put in a huge backlog right off the bat, right? So now, the first issue with that comes with what are the types of visits that they're now seeing, right? It used to be, maybe quick in and out, whether it was a cold or whatnot, but recently physicals haven't been done in 3 years. Those take a lot more time, right? Anxiety's gone up by 27% in patient care, right? So those types of visits, again, they take more time, right? So that means you're going to see less patients that day, right? Just because of that. So these are the types of visits is a big reason why, right? Whether it's a procedure, whether it's, not taking those into account, or whether it's, surgery or whatnot, but the types of visits are that the doctors now are seeing are a lot more serious than they were pre-pandemic, right? So these take more time means less patients get seen, right? Now, I'm not even going to get into the fact that there's a huge nurse shortage here in Canada, whether it's because of burnouts, whether it's because of the ones who were let go because, they weren't double vaxxed or whatnot. We have a huge shortage in staffing right now. Right. So again, that's going to add to more backlog, right? It's going to add to doctors taking on more, less triage, all that type of stuff. And again, at the end of the day, all this adds to a lot more on the doctor's care and a lot more backlog that they can't handle, right? And the biggest problem there is, I mean, it's easy to say, okay, well, what's the big deal? Instead of seeing them in 48 hours, you'll see them in a few weeks. Well, I mean, the mantra in the medicine has always been, you got to catch the disease early. You got to catch, any condition early, because that's your best shot at beating it, right? So now if, you were supposed to get a procedure today, but you're not going to get it for 6 months, those 6 months could be crucial, right? So this is a big problem we have here in Canada now, and we need to help doctors figure out how they're going to do this, right? So now, the problem is, one is the backlog, and then you go into, okay, so how are you going to help you with your backlog? Well, tell me how you spend your day, is what I often ask them, right? And you know what? I was surprised, at least, to hear that 40 to 60% on average is spent on paperwork, right? So that's at least half their day spent on paperwork. I spoke to some doctors who said as high as 80% is spent on paperwork, right? That means that those doctors are only going to see patients for 20% of their day, right? So which is a huge ask. That's not going to clear that backlog, right? So then it becomes, so what can you do? Either they got to put in more hours, or we got to see why they're spending, at least 50% of the day on paperwork, right? So now if I were to look at what their paperwork is, it's really broken out in about 3 different areas. One is, after you see a client, or patient, sorry, that's a sales guy to me coming out. After you see a patient, you got to put in a visit summary, right? That takes time. There's also all the notes that the doctors have been asked to do, whether it was all the COVID forms for traveling, whether it was the forms for schools, whether it was the COVID exemptions. COVID has created an immense notes workload for doctors that no one's ever really, no one sees, right? Every time the government says, you got to do this, you got to do that, very often it's a note from the doctor, right? And then obviously, again, it's the notes for the physicals. Camps are around the corner. A lot of the camps, at least here in Canada, require that the kids, they might have to go see a physical before they come in, depending what their age is. That creates a lot of work, right? And then finally, the third option is, billing. Billing takes a long time, right? After you see your patient and everything, at the end of the day, you got to do your billing. Here in Canada, you're allowed to bill up to 6 months behind. Right. I was talking to a doctor last week who's 7.5 months behind, which means that for 1.5 months, he's not going to get paid. Right. Those that's too far back. The rules are stringent. If you don't get them in, you don't get paid on it. So, that's loss of revenue for him. Right. Which is unfortunate for somebody who's pretty burnt out working extensive hours. So at the end of the day, I mean, what we're seeing in the medical field here is no different than we're seeing in any other job, which is, give me back hours to my day. That I'm not doing on paperwork, that I'm not doing on things that, wasn't really why I got into medicine. And, let me see my patients again, right? Let me help them. I don't want to lose these patients, right? I want to give them the best care possible. And a lot of them are getting angry because they call and they can't be seen for a couple of weeks, right? So, that's a perfect segue for us. When we come in, we're like, okay, well, we'll give you back hours. And then in turn, that'll get back that patient care and that'll just help everybody, right? So that's how it is here, right? I hope, I would think that's the same everywhere, right? So over to you, Tal.
Thank you, Dia. Appreciate it. So there are significant challenges, and I'm sure it's not foreign to our audience. So I'd like to start maybe this discussion and continue it. Speak about that impact, the impact of COVID, and how that actually impacted patient care. Maybe I'll start with you, Tyler, if you can share a bit of your insights here.
Yeah, sure. Thanks, Tal. Tyler Stoll, Automation Anywhere. I run the Rev Cycle practice here in North America, working very closely with Dr. Chow. And obviously COVID, when lockdown first happened, there was a complete lack of access to care. Communication was very, very difficult because you couldn't pick up a phone and just call and talk to somebody. So what we had to kind of focus on, we're all consumers of healthcare. And so our relationships with our nurses and our doctors were sort of cut off, and there was a lot of confusion initially. As consumers, we have different age groups, and different age groups are impacted differently. Younger people are oftentimes more apt to use applications for communication. If you're lucky to have an application to communicate with the provider office, younger folks could pick it up and they adapted to that very, very quickly. Children, obviously, under the care of parents, parents' anxiety went up because it was harder to, check in very quickly, what should I do for medications? So by and large, the biggest impact to patient experience was just the lack of communication with their providers. That intimacy was broken. And over time, the first year, as we all started to adapt, access to healthcare improved a little bit. And as Dio was saying, there's a backlog because a lot of the protocols were broken, right? So if you had diabetes or kidney dialysis treatment, the level of complexity that you had to go through to schedule and to receive care was astronomical. And I think one of the good things that came out of COVID was that there was a lot of innovation that kind of broke the rules a little bit because that care was critical and we had to mobilize to get care to the patients as opposed to having the patients coming into centers and picking up medication. So just a lot of change, but I think there are some good and some bad that came out of it. So back to you, Tal.
Thank you, Tyler. Dr. Chow, do you have any insight here?
Yes. Thank you for having me. I agree with Tyler. My personal perspective is as a physician who spent 32 years at Kaiser Permanente, last 8 years as National Director for Innovation and Advanced Technology. And after that, I worked with the federal government as a Chief Innovation Officer and later at Amgen as the lead for digital medicine. I joined automation area about 3 years ago to help launch the healthcare group because I really believe that healthcare needs automation. In terms of COVID-19, it really brought an urgency, as Tyler mentioned, to use different kinds of care delivery, including telemedicine and remote patient monitoring. And many health systems actually around the world found for the first time that even though these kinds of new care delivery had different requirements and considerations, they were actually quite effective for many situations. And as Tyler mentioned, many patients were happy to not have to come in and be exposed to COVID. Unfortunately, the huge increase in demand due to hospitalized COVID patients also led to a significant delay in elective procedures, which I'm sure most people are aware of, which meant that many patients had to wait and possibly get worse. So for most patients, the healthcare's contact center also became the primary touch point for advice and for the latest public health information. So there was a tremendous increase in contact center demand. And this is also part of the new patient experience. So finally, I think there was immense anxiety due to inability to see the doctor in person, shortages in face masks, changing recommendations, and social isolation. So I think what COVID did was create a perfect storm for healthcare. Back to you, Tal.
Thank you, Dr. Chow. Indeed, the perfect storm it is. So maybe double clicking a bit more on that patient experience or patient care and the quality. Maybe it's a more basic question, but why is it so important? Isn't just the outcome important?
Right. The patient care experience has been studied in the last 10 and 20 years and is actually more important than previously thought. Nowadays, it's been found that 80% of the factors that impact a patient's health actually lie outside healthcare. It's the patient's behavior, the environment, the support network, the income, their education, the access to care, and many other things that affect how well the medical care we prescribe actually works. So one factor is their experience with the health system. And there are a couple of areas where this experience impacts care outcomes. I think the first that I always think about is the area of trust. Healthcare consumers often don't really understand the quality of the medical care they receive. Instead, they tend to equate quality with the care experience that they do understand, which includes things like, was it convenient and easy to get advice and book appointments? Did doctors have and nurses have a good attitude towards them, treat them well, take the time to understand the concerns? Did they get their medical issues actually taken care of? And so on and so on and so on. So the more positive the experiences that patient has, the more willing they are to forgive an occasional bad experience. And all these factors build trust, and how well a patient follows a care provider's recommendations reflects how much they trust them. The second area is patient engagement. Is the patient involved with their own care? Do they take responsibility for their treatment? Do they pay attention to required follow-up tests? Patients' adherence to medication schedules and treatment requirements. This results in, if they do that, it results in lower costs, better efficiency, and results in more patient satisfaction, better outcomes. So if there are medical problems, do patients feel empowered to or know how to tell their provider? Many patients do not, and there are many reasons from, there are many reasons from forgetting appointments and medication schedules, or not being able to afford a medicine, or not being able to get transportation. One elderly lady I know has to take 20 pills at various times throughout the day. She sometimes doesn't remember if she has taken them or not, or even what each pill is for. So another barrier to engagement is that healthcare systems are sometimes hard to access in a timely manner to actually get to someone who can diagnose what's going on. So, and also not being comfortable with technology can be another barrier if telemedicine and remote patient monitoring are being used. So these barriers make a patient feel powerless and less in charge, so they're less likely to bring up issues. They'll avoid medicines if there are side effects without telling their doctor, or if less engaged with the health system, they will follow web advice rather than checking first with their doctor. So this brings us to a third area, which is that healthcare systems often don't have formal mechanisms to involve family caregivers. Today, 1 in 5 people is involved with providing unpaid care to a relative or a friend. Better information sharing, collaboration, coordination between the medical team, the patient, and the patient support network would really produce better compliance and avoid misunderstandings, no-shows, and maybe even find emerging problems earlier. And it's better for the patient, the caregiver, the family, and the health system. So traditionally, the patient care experience has not been very important to healthcare providers. When I was growing up, a doctor would tell you to do something and you would do it. Today, I see the patient care experience as an essential part of creating a partnership between the patient and his or her healthcare team and the caregiver, if there is one, where the patient is involved with their own care and care decisions. What do you think, Tyler?
No, all great points, Dr. Chow. And I think, in talking with you over the last 2 years with hundreds of provider organizations and some payer organizations, it was a moving target. Early on during COVID, everything just kind of shut down. But as the providers, as Dio was saying, started to take command and control of those backlogs, they had more time to do that patient outreach. And I think that was the biggest takeaway, is that patients became detached. That's how it sort of manifested. Not all, but a large portion of the population, because there was a lot of wait and see, a lot of confusion. Obviously, patients who required critical care, if they were lucky to have other family members involved, could be a lot more aggressive. But, the use of triggered automated communications, I think you and I have seen in a couple of our customers, sort of closing those gaps, those care gaps, by looking at certain profiles in the data and then triggering some communication that would be able to reach out with an automated email to trigger a response. So being more proactive as opposed to reactive. And that was what I thought, especially in the second year. There's a lot more outreach, electronic communication from my provider. My primary care physician left his practice, so didn't know how to get a prescription refill, and did my first telemedicine appointment. And I was surprised at how quickly I was able to do that as a consumer. But filling those care gaps and more frequent communication, electronic communication is really what I've seen is the key to really focusing on providers, focusing in on patient behavioral social challenges around COVID. Tal?
Thank you, Tyler. Thank you, Dr. Chow. So you touched telemedicine, and that's one of the let's call it the frontline or very highly adopted strategy for this changing environment. What other strategies, Dr. Chow and Tyler, do you see in healthcare organization where they want to improve patient care, especially now with the shortages in healthcare professionals, with a huge backlog? How can we help? How can the strategy help?
I think organizations that are focused on improving the patient care experience have a number of options. But for this session, I'll share how automation can address this challenge. First, I'd like to mention the term RPA means robotic process automation. It involves copying what people do at the computer and the rules they follow, typically as they perform very manual, repetitive, error-prone tasks. And these are tasks that computers can do much faster and more accurately. So I feel that automation can be one of the big game changers for patients and for providers. The first thought I have is that first I look at the transactional touch points between the patient and the health system. And this is often through a web portal, a mobile app, sometimes today email, text messaging, even phone messages. Even though many of these are convenient for patients and providers, much of the workflow still requires healthcare worker involvement. And the truth is, in many cases, predefined business rules could be applied to turn these interfaces into fully automated self-service experiences for most patients. Patients get their answers and solutions faster, and healthcare staff really only tackle the exceptions and complex cases, and that frees up a lot of time. For instance, when I deposit a check in my bank today, I can simply take a photo with my camera, with my phone actually. Security is built in and that's it. Why can't I take a photo of my rash the same way? In fact, AI technology has been shown to diagnose rashes for cancer as well or better than dermatologists. So patients compare their care experience in healthcare with other consumer experiences. And I think that's where healthcare sometimes falls short. For situations where the touch point is actually person to person, such as when a patient calls a contact center or walks into a doctor's office, a lot of that interaction is taken up by the staff having to check multiple databases to confirm demographics, medical history, and other facts. Patient is put on hold or waits. And often, and you hear this a lot, they have to repeat their details to multiple people. It's not an ideal experience. Nowadays, it's interesting that experience is often shared on social media like Yelp, where over 95% of the complaints are about the experience of care, not the quality of care. Automation can actually address that problem by accessing databases much faster and more accurately, which, as I mentioned, frees up the staff to really listen to and empathize with the patient. Automations can also initiate actions based on rules, such as book appointments automatically based on preventive health guidance. Reminders and alerts can be automated to reduce no-shows, prepare the patient for upcoming visits, remind about the prerequisite routine testing, even automatically generate test requisitions at the lab. This is my system. So this produces a consistent and persistent patient care experience that sort of reinforces the impression that the health system really cares about you. The system takes on more responsibility, which the patient will always appreciate. But here's the exciting part. Beyond the transactional processes, there's an exciting potential for automation through artificial intelligence to personalize the care experience for each patient based on their condition, their history, their behavior, many other factors, so that the patient feels like the health system really understands them. It's like the old days when you walk into your doctor's office, be greeted instantly by your name, by the nurse. You're asked questions about your family, the issues from the last time, and so on and so forth. You really felt like the doctor really knew you. Similarly, AI can draw from a large universe of data to really understand your situation, and it's a lot more scalable. It's feasible actually to bring that kind of customization to thousands of patients, not just a few that you happen to remember. So that personalization not only improves the patient's care experience, but potentially also predicts risks and likelihood of emerging problems that the health system could address early, to Tyler's point, which prevents later complications or expensive hospitalizations. For instance, an artificial intelligence system detecting that a former family caregiver has moved to a different city could proactively ask a patient if it could help them arrange transportation for an upcoming visit. Otherwise, what happens? That patient will miss that visit and their condition worsens unbeknownst to their care team. And here's a final thought. Just like for business in general, an important principle is that poorly motivated employees will produce poor consumer experience. So happy employees means happy customers. This is true in healthcare as well. Healthcare, as has been mentioned, is currently plagued by a severe shortage of staff. It's almost impossible to recruit new workers given what the industry went through the last 2 years. How can you incentivize healthcare workers to stay on the job, to take the risks that they do, to sacrifice? Part of the answer is to make sure the jobs are meaningful. And that's why they went into healthcare in the first place. One survey found that 63% of healthcare workers felt a significant part of their jobs could be automated. Imagine a future where healthcare workers are not burned out by meaningless tasks that could be done better by computers. And I think that in that future, each healthcare worker will have their own digital assistant that helps the worker be more productive, more efficient, as well as more engaged. There are numerous tasks in healthcare that could be automated. Automation is faster, it's more reliable, more accurate. When you go to doctors, you don't want that doctor to be busy filling out forms. In the limited time you have, you want their full attention. So improving the healthcare experience will lead to better patient care experience and a higher quality of care. So it's a win-win for both patients and providers. How about you, Tyler? What do you think?
Yeah, a lot of great observances. To your point, I think where I've seen a lot of improvement in interpersonal communication, let's say between nurse and patient, we're seeing automation reduce handling time on interpersonal communications, post-call follow-up notes by as much as 50%. Streamlining scheduling, right? Again, a 50% reduction. It's not, automation can't do all of it, but it can also reduce the amount of hold time and authorizations by shortening those call times. We've also seen, automation can free up, I would say on average, between 2 hours a day for healthcare providers. And then on the administrative side for post-encounter work, such as billing and errors and rework, about 2 to 3 hours a day. And that's for like a medium-sized organization. So what does that mean is to the patient is that's more proactive provider time, spending time speaking and communicating and analyzing, as opposed to, as Dia said in the very beginning, working those backlogs, because nobody likes those backlogs. It's hard to focus and it's hard to pay attention to some of the details. So, a general improvement on making those communications more fast and frequent, so that those patients feel that they're being paid attention to. So you can pay attention to the organization, the behavioral changes that are happening, and reducing some of the effort on the patient side and confusion. So that's really what I've seen, especially when it comes to telemedicine and technology, helping close those gaps and improving that patient experience by leveraging automation technology. Tal?
You know what? Maybe we'll get into our first question of the day, and maybe we'll ask this of you, Tal. Rosemary is asking, how many of your clients are in the hospital system today, specifically in Ontario, if any?
Hi, Rosemary. Thanks for the question. We don't publish our customers. They're not allowing us to publish, but I would just say we don't have an hospital in Ontario, but we have many in the US. We've just been here for about 18 months. In the US, we have customers like Mayo Clinic, Kaiser, and Stanford Health that are working with us, and many, many others. In Canada, we have about 55 customers, some of them are very large. So I'm happy to share with you a bit more one-on-one in this forum. Is there another question there?
Yeah. So the second question is, how do you get patients to trust automated healthcare services when they're unfamiliar to the user?
Maybe Dr. Chow can take that.
Yeah, I think, as I mentioned, how do you build trust? I think part of that answer is to have a positive experience over time. And so, for instance, telemedicine, totally unexpected. Many healthcare systems didn't trust it, didn't trust the evidence behind it, didn't want to use it. But COVID forced it upon us, and with experience over time, they started to see what things should be appropriate for telemedicine or not. I think the same thing will be true for automation. When patients deal with automation, I don't think you should tell them that they're dealing with automation. But if they deal through a web portal, a chatbot or a contact center, the fact that they're getting services, solutions, and answers faster and consistent with the messaging that they're getting from a doctor, and they're aware that this is a system that's helping them get those answers faster and more reliably and reducing the administrative burden for them, I think over time they'll take it for granted that any doctor that doesn't use this is going to be hopeless to be behind and require a lot more from them. So I think it's the benefits over time that's going to build that trust. And in addition, if the doctor is also feeling much better because they're not having to do a lot of that, I think they'll get a better experience from the people in the healthcare system as well.
It's like you said, yeah, you got to expect the curve, right? There's going to be an adoption curve. It's no different than self-checkout, right? Mm-hmm. Originally, nobody wanted to use it. And then you get there now and you see a backlog at line 3. So you go to the self-checkout so you could get out of the place a lot quicker, right? So, it's going to be the same type of thing.
Yeah.
There's going to be some pushback at the start, but then when you realize the benefits, it's going to be taken, right?
In fact, I remember when ATMs first came out at banks and nobody used them because they wanted to talk to the teller. And today you go to the bank, there's a line at the ATM and the tellers are free, but nobody wants to use the tellers. So, it's sort of, I think it's going to be kind of like that a little bit. Yeah.
Yeah. The next stage is no one wants to use cash. Kathleen has a question if we have experience working with primary care physicians.
Yeah, so our experience is we have a lot of experience with primary care physicians, but not in small practices. Most of them are affiliated with large systems, but we are very familiar with the issues that primary care physicians and offices have to deal with, including coordination and interoperability with medical records and sort of all the financial and accounting systems, revenue systems, things like that. So yeah, we're pretty familiar. If you have specific areas that you're interested in, we can certainly discuss more. Yeah.
Thank you, Dr. Chow. So I do want to touch another subject that is close to my heart, and I'm sure to many Canadians, which is mainly EMR systems. So the MRIs of the world and the cities of the world and scheduling. And I want to divide this question into two. We have the side of the system. The system can take what it can take capacity-wise, and it can take as many patients as possible. But then there's scheduling side. How do we help combine those two on a call center side, maybe, and then on the application itself? Like we all know that things like Meditech and Epic are pretty close applications, and it's not easy to work with. And sometimes the system becomes the bottleneck instead of the enabler. So any input on that, Dr. Chow and Tyler?
Yeah, I think I can take the interoperability piece, and maybe Tyler can take the appointment scheduling and automation of that piece, the contact center piece. There's actually very exciting news in the US today, and that is that the federal government in the US is really pushing hard on interoperability using the international standard called HL7, and specifically the latest standard, which is HL7 FHIR, FHIR. And in fact, they're imposing very severe penalties for not being able to interoperate. So this is an international standard, and it's likely that most other countries will do the same thing, which means that healthcare systems and EHR vendors and so on will be required or mandated to be able to make the data that's in their systems available upon request to the authorized parties. And this is something that's never happened before in healthcare. We've tried to do it for many years. It's only now that it's really got some regulatory pressure behind it, at least in the US. So what that means is that these vendors and these organizations will start to develop these interfaces, and we are actually right on the forefront of that. We have been developing automations for those interfaces. And in the future, I can see that the transfer of data between systems and between doctors, and even for patients to request information, all that would be very much accepted as the way we do business. And it's going to be a lot easier for organizations to reduce waste, to reduce redundant testing, to really get a better picture of what's going on. Yeah.
Tal, what was my question again? Sorry.
On the scheduling side, we've all been there calling, if it's a department, if it's to schedule an EMR or MRI or a CT, or just a doctor appointment. Sometimes we hit a big call center in a hospital. Sometimes we hit a clinical center. Can automation help us with that?
Yeah, and very much so. When I think of the portion of healthcare, it's pre-encounter, right? So it's all the communication necessary to make sure that the patient's ready. Any financial information is accessible. The scheduling itself, if it's a referral. We look at existing systems and study how it's done today, right? We call that current state. And we can very quickly design an overlay to streamline the scheduling. It may not be able to do all of it, but it will get it to a certain point so that when an administrator picks it up, whether it's on a call or whether it's coming in through electronic communication, you have fewer steps in order to get that in place. So that pre-encounter step and all the things required to make sure that patient is ready for scheduling and can proceed, there is automation benefit. And to an earlier question, trust around, using automation in healthcare, much of that is transparent to the patient. All they see are the benefits of the provider and the practitioner serving them, being more attentive, more time, more frequent communication. There's very little impact in terms of technology that a patient would experience. It's really just the benefits that they would see from their provider. So.
And I would say a lot of our focus today with COVID is actually scalability. Can we make healthcare sustainable? Can we reduce delays? Can we get problems taken care of early? All those things have been goals of healthcare for a long time, but we haven't really been seriously looking at those solutions until COVID hit. And COVID really exposed the structural issues that healthcare has had for years. And so part of what I see for automation is that it really is going to help us move healthcare into the 21st century. We're still operating on a 20th century model, moving healthcare into the 21st century means that our jobs will be different. Inside healthcare, our jobs as patients will be different. Patients today are a lot more knowledgeable. They have access to a lot more information. Same thing should happen in healthcare. That is, the roles of the physician, the nurse, the receptionist should not be to do a lot of things, is to leverage technology to do the things that could be much better done by computer. And so you reduce the friction for patients. The experience is a lot better. The outcomes are a lot better because of that. So I really think that's going to happen.
Yeah, thank you, Tyler and Dr. Chow. I'll just add one thing, and I think we saw it in some of the questions here. Also on the provider, practitioner side, the healthcare professionals that need to deal with it. Maybe you're sitting now at home or at your practice and you're thinking, oh, another tool. Oh, I need to know another technology. The goal of automation is actually to simplify that. It's not another tool. So for instance, our technology can embed in any of your application as a button. So you don't have to think, oh, I have to train myself. Not only that, you can actually kind of make one single pane of glass for the practitioner through automation. And in the backend, it will interact with maybe 100 different applications. But you actually make the experience of the practitioner easier. Oh, I just want a button for this and a button for that and a button for this, and it does everything in the backend. Like Tyler mentioned, the result of that will be that you will spend more time taking care of the patient, more time taking care of the outcome, a positive outcome, a better outcome, and that's that. I do want to touch a few more things that are burning, but you feel free to hit more questions in the chat box if you have any. But I want to touch something that is very relatable today: supply chain. Supply chain is part of patient care, because if you can't get the things you need to take care of your patient or the drugs, you might be in a problem. You might have to send a patient to go to a hospital in another city, or fly things, or even delay care. I want maybe Dr. Chow, if you have some insight, because this is a big problem not only in healthcare but worldwide in these days, and I think automation has a big part in mitigating it.
Mm-hmm. I think there is a lot of focus on supply chain today because of the issues we had during COVID. We couldn't get masks, we couldn't get ventilators, isolation rooms, things like that. All those things are part of the supply chain. In the past, hospitals are always designed supply chains in just-in-time principle, right? So they want to minimize the stuff they have sitting in the warehouse, and they want to use it just as it arrives. So that obviously went out the window with COVID because we didn't have enough. Like I said, it was a perfect storm, and we had no supplies from the Far East. We couldn't get things. And so now people are talking about a couple of different approaches. One is to have greater visibility into supply chain. And visibility means data access and looking at systems of suppliers and distributors. That's very prohibitive in terms of labor. But you can automate that. You can automate that supply chain visibility and get an idea of your risk. If things are starting to dry up upstream, you can start to prepare. And the way that people are preparing are by developing contingent supply chains as well as local supply chains. Local supply chains are interesting because it means that you have to have relationships with local suppliers, and they need to have forewarning of the need for supplies. So I think there's a lot of preparation for the future, but definitely the informational part of it is going to be really important. The interesting thing also is that coming next year in end of November, I think, there's a law in the US called the US Drug Supply Chain and Security Act, which is going to require that every medicine, from the time it's made to the time it arrives in your hands as a patient, will have a serial number. Every medicine will be tracked. Every medicine will be, for instance, COVID vaccines, they have to be refrigerated at minus 25 degrees Fahrenheit for the entire transport. If they don't, they're not good. So there are certain trends in the pharmaceutical industry, in the medical equipment industry, that require very close tracking of supplies and sort of the detailed log of what happens to them. And so that's another factor, besides the supply chain risk, is another factor in terms of quality of the equipment and medicine that we receive. So I think that area is going to be of great focus in the next couple of years, and automation is going to be a big part of keeping tabs on the supply chain.
Thank you, Dr. Chow. And maybe the last subject here is HR. sounds grayish to an extent, but we have to remember that employee experience will be equals patient experience, and that equals patient care. And when we speak about the stress that is currently going through the system, it ends up in humans, that needs to deal with a lot of things. Maybe a bit of insight, Dr. Chow and Tyler, on that, and how you see HR transforming to support this almost insane pressure that humans are under, employees are under.
After that, we have a question for Dr. Chow, if we could get to it after this.
Better let Tyler speak to this one. So, Tyler, you're going to talk about HR?
Sure. So the big impact I think that COVID had on the healthcare ecosystem was around labor shortages. And how those manifest is that if you're credentialing, if you're bringing on certified physicians or healthcare practitioners, the cycle time has almost doubled. Let's say almost 150 days out. And what happens is there's dropout. So a lot of these facilities are working at about 30% under their normal capacity. And that's creating further backlog. It's creating burnout, and it's harder to retain people because people have to shift and reallocate labor to other parts of a health system. So what we see with automation is the automation compresses that cycle time, and it's automating a lot of the communications that a recruiter would have to do, all of the documents, the certificates, loading into a system in order to fully credential and onboard a medical practitioner, which then goes into scheduling. So the worker experience, again, less frustration, less confusion around, did I receive this document? Did I not receive that document? Compressing that time, allowing recruiters to go out and do more of their recruiting and onboarding work. And then again, at the desktop, it's just freeing up time. If you buy into the concept that time is our most valuable commodity is humans, then having 2 to 3 hours a day back from automation is very, very powerful to do your job better under less stress. So that's usually what we see is just lower anxiety and stress all across, whether it's patient, doctor, nurse. That is the impact typically. So people can really focus, get their job done, and have time to go home and have dinner with their families.
Thanks, Tyler. Yeah, go ahead with the question.
So Claudia is asking, she said, Dr. Chow spoke previously on different types of automation in healthcare, such as RPA, and acknowledged that there's a period of adjustment post-implementation. I've had experience with RPA in supporting primary healthcare delivery, and still a year on, the amount of administrative backlog is still growing. Is this an issue of lack of scalability? And if so, how do you efficiently implement these automations in a manner that helps rather than hinders?
That's a really good question. And that's a question we deal with on every account. There are a couple of aspects to that. The first is has to do with the technology itself. And I want to call out two things about our platform. One is that it's a native cloud platform. That is, it is built native to the cloud. It means that you can scale. All you need is a browser. So the technical scalability is not an issue. We actually have organizations running nearly 20 or 30,000 bots concurrently. So the scalability is there. The second thing is, in terms of scalability, you think about what hinders it. One of the things that hinder it is that you have a limited IT capability so there's a queue, so when people want automation, they have to wait. And so they start to go off and do other things and they lose focus. I think that the citizen development part of it is very important, because if you provide for citizen development, which is what our platform philosophy is all about, you can have the business unit start the process of building automations and have IT finish it, getting ready for production, so that you allow people to start designing all through the organization and start to be familiar with it. The third thing about scalability for our architecture, in terms of our architecture and platform, is that we have this, like Tal was mentioning, this thing called a Automation Inter-Robotic Interface, or ARI, A-A-R-I, which is actually a user interface that abstracts the complexity of automation away from the user. So you can provide, based on their role, customized interfaces that they can use, that they don't have to think about automation. You can just click a button that says, send a copy of the invoice to the patient. You don't have to worry about what system you have to go into, the login to, the request, and all that kind of stuff. That's the technological piece of it. More important probably is the organizational piece of it. And that's something where we've had a lot of experience, and we've seen a lot of different organizations, both those that are very successful and those that are stuck at 5 to 10 bots, to be honest. And why are they stuck? So we've been studying that. And one of the key principles for using automation as an infrastructure technology is that you first have to develop early successes, and that means that you have to really look at the first couple of processes that we would recommend, and you look at them for certain criteria, and we have very concrete ideas about the return on investment, because those early successes will help to pay for later successes. And that's something, if you're talking to the chief financial officer, you need to be able to show the business case, and that's very, very important part of the staging of automation. The second principle is establishing a center of excellence. A core, it could be just one person, but a core of a few people that really have an interest and a passion for automation that can help to be a source of expertise and a source of, and be able to learn from other customers' experience, from our experience, to be able to build a sort of a pipeline of automation so that you don't stop at the first one or the second one. You actually have many business units putting in requests. And part of that is, I've been in innovation for a long time. Part of that is evangelism. It is advocacy, but it helps to have successful early use cases that you've proven. And there are many, many areas that you can do that in. HR and finance are two of them that people have traditionally done very well with automation, and many, many others. So I hope that answers the question. There are many aspects to growing automation in a company and getting more success, and we've certainly had a lot of cases where that's been able to be done. Yeah.
Tyler, you wanted to add something? Chow covered it.
Thanks, Tal. Just one other sort of observation in Claudia's remark. Most automation programs are designed specifically to go after backlogs. So just understanding the automation potential of other use cases in that general proximity in order to unlock value, looking downstream, is it a data issue? Maybe the bots aren't designed properly, things like that. But it's per the scale description that Dr. Chow went through, those reductions in backlog should be noticeable, especially within 1 year. So it's just understanding, are they designed properly? Are there other pre-automation steps that could feed into them, or downstream automations that could also reduce the backlog and increase the benefit? So
yeah, one principle I want to mention, and that's a really good point, Tyler, is that as you think strategically about your automation roadmap, and I really believe automation will be an infrastructure platform, think strategically about where you're going with automation. I think, for instance, for some organizations, if you find that certain, granular parts of your automation tend to be used over and over, you might want to focus on those first. Things that could be reused later on have huge potential to multiply the development time and effort you put into it. So for instance, if you find yourself always accessing your electronic health record in a certain way, that's a separate module you should develop to automate. And then you can have many processes do that. So that's the kind of strategy that it depends on each organization. In healthcare, it's very individual, what you have set up in your organization, but there's a lot of potential. So I would recommend that you look into it more. We can certainly help if you like to talk to us, but there's a lot of ways to look at automation that I think it's very exciting, high potential.
Yeah. I'll add two things. One on the strategy type, and two on the technology and how automation anywhere is differentiated. The way we like to see it is like a multi-lane highway. And when you go on one lane, and many customers decide to do that, those are those customers that Dr. Chow mentioned, we're stuck on 5 bots. We haven't expanded beyond that initial use cases. They went one lane, meaning they used one use case. And by the way, for many objective reasons, those lanes can slow down. process, system, people. A lot of things can happen. We recommend customers to at least go 3-lane road, because a 3-lane road will actually allow you to advance in some. Remember that a 1-lane road, when you come in with a new technology, it can create a brand to the technology that it's not working or something is not, and it won't be adopted. When you go 3-lane road and 2 are moving fast and 1 is a bit slower, the 2 fast will carry more weight. And then it will, the goal is to create automation as a discipline in the organization. Our best customers are actually driving a 10-lane road with 10 use cases built in the same time. And the average of successful customers is about 6. So that's one thing. How do you achieve that? You need a very, very simple platform. You need a platform that was built for the business user rather than being dependent on IT, on developers or data scientists. You need to actually give it to the users that are running the process and let them develop their own automation with a bit of enablement and guidance, not make them developers. And how do you create that? This is how we built our system. Our system is built for the business user. And that's why if you compare us to any other competitor, it will be 2, 3, 4, 5x more automation within, the first year, the second year, the third year. And the reason is adoption. If you have any last questions, feel free. We have 5 more minutes. We really appreciate the time you spent with us today. Feel free to contact us. I'll drop my email in a second in the chat box, but we are all on LinkedIn and we are all very responsive. So feel free to just reach out anytime. Any closing thought, Dr. Chow?
Yeah, Tal, I want to mention also, you're talking about our platform, that there is an update to our platform. As a couple of months ago, we purchased a really industry-leading tool for process intelligence, so that if you're wondering, where do we go next? We've automated this, it's great. Where do we go next? You can actually use that tool to find out what people are doing and what processes are likely to be successful, to be automated next. And that process also is very good for benchmarking, so you can have something to compare against. So I just wanted to mention that. That's actually a pretty cool tool. So it's worth taking a look at. Yeah.
Thank you, Dr. Chow. Yeah. Tyler, any closing thoughts?
No, it's automation is very human friendly. It's meant to give us back our most valuable commodity and asset, and encourage folks to think about it in their practices and in the hospital to really enhance and enrich patient experience, because as consumers of healthcare, the patients have really had a tough road over the last couple of years, as have our providers. So looking for those buffers and those things that allow us to do our best work from a humane standpoint. Thanks for everybody for their time today.
Thank you very much, folks.
And sorry, just one last thing I wanted to add was, there was a lot of questions around how do we get patients to accept the automation, and although that's a great area where automation can come in handy. We mentioned a lot of other use cases that are automation on the logistical side, right? Whether it's paperwork, administrative, a lot of things that don't have anything to do with the patient, but have to do with the doctors and the work that they have to do, right? So don't let, I'm only advised to, because a few different doctors have mentioned this, and I would just say, don't let how would patients accept automation slow down your automation journey, because there's many places where you can find benefits before you even have to tackle that.
Mm-hmm.
Thanks, Dia. Ashley, back to you.
Yes, thank you, everyone. Let me just share my screen right here. Well, thank you all. What a great presentation, and all those questions that were coming in was very appreciated. As everyone was saying, feel free to jot down everyone's email address. You can find automation anywhere on LinkedIn. Feel free to reach out to them directly, or I'm here as well to assist if you need anything. All right, so we'll just close it off with what's coming up for this week. This is our last week for Webinar Wednesdays, which is tomorrow. You could register tomorrow on our website for tomorrow, as well as our virtual career fair on Thursday. All right, so everyone said their last minute talks. Let's see if there's any last minute questions here.
You're asking about the recording.
Right, yeah. So someone was sending a message about recordings. It is going to be available by the end of day today. I am quickly looking through so I could send you the link from our website, but you will be able to find it there. Just a few more seconds. All right, and if this doesn't work, please feel free to just reach out to me directly. I'll also put my my email address in the chat box if this link doesn't work. All right, and also finally, I will be sending a survey for everyone. If you can just take a quick look and respond. I did put the link in our in the chat box, but I'll also send another email to all our registrants with our survey link. All right, so it is our 1 o'clock mark. We want to thank you all for being here today. Thank you so much, panelists and all our attendees. Have a great afternoon, and thank you all again.
Thank you.
Thanks,
Bye.
everyone.
Thank you.
Okay.
Thank you.